How is erythema nodosum treated? Have you ever wondered how to tackle erythema nodosum, especially when it's linked to inflammatory bowel disease? This condition can be quite uncomfortable, showing up as tender red nodules, often on the shins. It's important to understand that treating erythema nodosum is closely tied to managing the underlying inflammatory bowel disease. When inflammatory bowel disease is active, controlling that inflammation can lead to improvements in both gut health and skin symptoms. Common treatments for inflammatory bowel disease include corticosteroids like prednisone, five-aminosalicylates, and immunomodulatory drugs. These medications work by reducing inflammation throughout the body, which helps with both bowel and skin issues. For those who find that standard treatments aren't enough, biologic therapies can be a good option. Anti-tumor necrosis factor alpha agents, such as infliximab or adalimumab, target specific pathways involved in inflammation. They can be effective, especially when other treatments haven't worked. However, it's worth noting that there are rare instances where erythema nodosum can develop after starting some biologics, so regular monitoring is essential. Symptomatic relief is also key when dealing with erythema nodosum. Many people with sensitive stomachs or colitis need to be careful about the medications they take. Non-steroidal anti-inflammatory drugs are often used to reduce pain and inflammation, but they can worsen intestinal symptoms in inflammatory bowel disease patients. Instead, ice therapy can be a soothing alternative. Applying an ice pack wrapped in a towel to the affected areas for about 20 minutes can help reduce redness and discomfort. Rest is another important aspect of managing erythema nodosum. The condition can cause fatigue, which may add to the tiredness already felt during an inflammatory bowel disease flare. Giving your body the time it needs to recover can help improve overall symptoms. In some cases, topical treatments like potassium iodide solution or colchicine might be used for persistent erythema nodosum. However, these are less common when the condition is linked to inflammatory bowel disease. To sum it up, treating erythema nodosum in the context of inflammatory bowel disease involves controlling the underlying inflammation with medications like corticosteroids, five-aminosalicylates, immunomodulators, or biologics. It's also important to avoid non-steroidal anti-inflammatory drugs due to their potential to worsen gut symptoms. Using ice therapy and ensuring plenty of rest can help relieving pain and swelling. Lastly, topical or alternative medications may be considered if they are appropriate and well tolerated.